All right, Megan, thank you. People with diabetes have special health challenges. Up next, a doctor offers some advice for avoiding some big problems.
6.5.
More than 20 million Americans have diabetes. That number is only growing. 15% of all diabetic patients can expect to develop some kind of foot problems, a foot ulcer specifically, during their lifetime. Dr. Evan Smith of the ETMC Wound Healing Center is here with us now. Thanks for being here. What is a foot ulcer?
Well, it's basically just a sore on your foot that can be painful, and it can have other consequences as well. It can lead to, worst case scenario, amputation of your leg.
And that's usually something, the greatest fear for somebody, I guess, with diabetes, right?
That's, most patients that come to see us at the ETMC Wound Healing Center are worried about whether or not they're going to get to keep their feet.
Wow. So how do you avoid this? Obviously, you know, diet and exercise for the diabetes, I guess, to avoid diabetes, if that's possible.
Correct. You want to, you know, the story before us kind of showed large people, and one of the things that you've got to do is get your waistline under 40 inches.
Wow.
And studies show that that really helps prevent diabetes. But it's also important to, for folks who already do have diabetes, to work with a physician to get close management of that sugar and keep it under control.
And we have a graphic to show you some things that are recommended by doctors. First of all, annual foot exams.
Correct. That's very important, and not only annual foot exams, but daily foot inspections as well.
What are you looking for?
You're looking for any hot spots, so to speak. You want to look for any color changes on the skin, any change in the temperature, any new pains with your in your feet, fever, of course. Just anything out of character. People know their feet, their own feet, their best, and if anything's out of character, they need to get to their doctor.
You also mentioned proper footwear here. Why is that so big a deal?
Sure, it's important for folks with diabetes. They can't feel their feet as well. They develop a condition called neuropathy, and that's just a fancy word for a numb foot. And so we've had people who've had actually insulin needles embedded in their feet, and we found on an x-ray, and they didn't even know that they had them in there.
Gosh.
So it's important to have good footwear all the time and not walk around barefooted and have proper fitting shoes. It's something that folks with diabetes don't want to skip on, is good shoes.
We're going to have a whole list of all these things that you need to be aware of for diabetic patients on our website, cbs19.tv. Bottom line, time frame, when you see something wrong, how quickly do you need to be in contact with a doctor?
Well, I tell my patients all the time that things break down a lot faster than they heal up. Okay. So the sooner you can get help, the better. And we can be reached directly by patients. They don't have to get a referral through their primary physician. They can call the wound center directly, and we can see them.
Outstanding. Again, check out cbs19.tv. Dr. Evan Smith, thank you very much. We appreciate it.
Thanks
Take care of the feet. We appreciate that.